Hi, my name is Dr. Glenn DuPont, and I'm a dentist here in St. Petersburg, Florida. Actually, I've been a dentist here for 35 years now. And as you all know, we have products come and go, and we've had a lot of changes in dentistry. But I'm here today to tell you about a product I really like, and it's the Denar Deprogrammer by Whitmix. One of the reasons I like this is that it's wider than some of the other deprogrammers that you might find on the market. It's got a little more width, so it has a little more stability. The other reason I like it is it's a permissive deprogrammer, which means it's flat. It will allow the patient's mandible to slide anywhere it wants without the teeth getting in the way. Some of the reasons I would use this deprogrammer is to provide and decide if it's an occlusal muscle problem that we're dealing with, or if it's an intra-articular problem, something right in the joint. Because this is a flat permissive device, I can place it in and wait about 10 minutes, let that patient just chill out, relax 10 minutes, come back, and see if we've made a difference in the muscle palpation tenderness, see if we've made a difference maybe in the opening, the range of motion, or see if we've made a difference in the patient's headaches and discomfort as they sit here. And I've been amazed at how often patients with muscle pain and headaches, in 5 to 10 minutes, they're gone. Another reason that I really like this device is that it can be used on the upper or the lower arch. And why would I choose one versus the other? Well, if the lower teeth are crooked, or one is higher than the other, or they're at different levels, I might want to use it on the lower arch if the uppers are even, to cover the uneven arch. Most of the time I choose to use it on the upper, as long as the lower anterior teeth are somewhat straight and somewhat level. So let's go ahead and take a look at how we would use this in the mouth. Okay. So when I use this in the mouth, what I'm going to do is look at the lower anterior teeth, and if they're pretty level, then I'm going to place this on the upper arch. And I'm going to make sure it fits okay, and there's room for me to move it anterior and posterior. One of the keys to this device is when I place it in, bite down gently, if the patient can slide forward past the front of this device, then I can move it, shift it forward a little. Then I'll slide back, bite on the back teeth. If the patient is biting way back, let's say a class 2 patient, I can actually move it back a little bit to cover that. I want to cover the patient's total extensive protrusion. Open up. So once I've put it in there and I've sort of decided where I'm going to be placing it, then I can go ahead and reline this. And this is the beautiful thing about this, it can be done quickly and efficiently. So now we're ready to place this in the mouth, and I like using a really rigid, firm bite registration material to place that. And I used to cut retention in these to help retain that material in, but as you can see, they've designed that into this deprogrammer. So they've designed some retentive areas in the deprogrammer. So all I need to do is take my real firm bite registration material and place it in. And I want to fill it up all the way up. I want plenty in there. I'm going to place that on the mouth. I don't want any extending past the occlusal plane here. See the whale tail? And then I like to use this, a whale tail by Great Lakes. Bite down gently, hold gently. Okay, open. And what that does is that positions that perpendicular to the long axis of these lower anteriors as they close. And before that sets totally, I can bite down gently, open, make sure that's hitting, and then you don't want to touch it. You don't want to move it. You want to make sure that that stays nice and rigid and sets up. If you have the patient bite, if you have the patient move around, it'll actually loosen that up, and then it won't be retentive. And don't be afraid if you get material coming back this way or this way on it. That's fine, as long as it's not below this plane of occlusion here, the plane of this device. Let's have a little, do you have an excavator or something? If you get a little excess material on the top of it, make sure you remove that. We don't want anything rough, anything bumping around. Make sure it's nice and smooth. Very good. And this material sets very quickly, which is why I like it. So now it's pretty well set. I can manipulate the patient. And just let your jaw relax gently. And slide forward gently and back. As far forward as you can and back. Okay. So we can see this patient's moving forward and back. And nice and relaxed. Now, just relax on that. I can actually let the patient relax on this as it is and walk away for 5 or 10 minutes and then come back and see how she's doing. Another thing that you can do, which is very nice, is to put some articulating paper in and bite down, slide forward and back, forward and back. You can actually create almost like the old-fashioned Gothic arch of looking at the extent of the protrusion. Now, when the patient slides back, let me see a mirror. Let's see a probe. So I can look at this line here where the patient's on the articulating paper, and I can see the distal extent of the line and the mesial extent. So we're going to mark that again. Go ahead, bite down. Forward and back, open. And that distal extent of that mark is very close to centric relation. It may not be centric relation because we haven't really diagnosed if there's an intra-articular problem or if there's something going on in the joint or some inflammation. But that's very close to centric relation. And it may be centric relation once we get it all said and done, but at this point we can't be confident of that. But we do know that's the distal extent of her motion, of her protrusion and back into the condyles here. So I can go ahead and manipulate that. Now slide forward, back. Is that comfortable? Mm-hmm. Okay. Slide left and right a little bit. Okay, good. So let's mark that with red. So I'm going to mark left and right with red. Bite down, slide left and right. And what I'm feeling for is any kind of bumps. So notice my hands are on her mandible and I'm feeling, bite down, slide left and right. I'm feeling for any kind of bumps. Okay, relax there. Especially keep an eye on these eye teeth, these lower cuspids as they come up. And bite down. If she slides and if this cuspid was higher, it might bump on that device, and we don't want that. We don't want anything bumping on the deprogrammer at all. Okay? And then we can just let her relax and come back and we can retest the muscles. Now another nice thing about this device is when I come back and everything is more comfortable and I feel like the patient's looser and I feel like I'm closer to centric relation, I can load test comfortably, I feel like it's a occlusal muscle, not an intra-articular problem, I can record that relationship with a bite registration material. There's two types that we use. One is the bite putty and the other is wax. So let me show you how we would use both of those at this time. How's your muscle comfort at this time?
Good.
Good? Mm-hmm. Now open, let your jaw relax gently. When I give a little pressure here, is there any tenderness in either joint?
No.
Okay, let me give a little more pressure. How's that? Is that comfortable? Mm-hmm. Now you squeeze hard. Squeeze hard. Any tenderness in either joint? Mm-mm. Okay. So when I come back and now the patient is more comfortable, she's been sitting here 10, 15 minutes now, even less. So she's been sitting here 10 minutes, now the patient's comfortable. I can confirm it with load testing. Her muscle comfort has increased, so she has less discomfort. Now I can go ahead and actually use this as a help to take a bite registration. So if I want to mount her models, if I want to mount her casts of her teeth and study that, I need a bite registration. So this is a really nice device to use to get that bite registration. So let me show you how we do that. Okay, one of the first things we're going to do is we're going to locate where that distal part of this black mark is. So let's put that articulating paper in. Can you double it? So we're going to remark this. Now that we're comfortable, bite down, slide forward and back, open. So we're going to remark it and then close slowly. Good. Open a little. Let your jaw relax. All right, we're hitting at the same spot whether I manipulate or she closes, right at the back part of that mark. So I'm going to get a little flowable composite. Open up. And the first thing I'm going to do is roughen that area. I'm going to roughen this spot just a little bit so that we get a good bond of this material. And let's have a little, do you have that Vaseline still? And I'm just going to put a little bit of Vaseline, a little bit of mask on these edges. Very little, very little bit. And close slowly. Open up. And I'm going to put a little bit of flowable material here. Not much. I want you to see how little we're putting. We don't want a big, a large amount. We don't want to affect the arc of closure. Now, close slowly. Hold it gently right there. Don't move. And we can polymerize that. Now that patient will go to that spot time and time again. Open up. Okay, open. And then I want to be sure that that index is not too deep. So as we close, that we don't hit a deflection. That would deflect it forward. And that feels real good. Now she can go to that spot time and time again. Close gently. Right into that spot. So now it's real easy, very easy at me at this point to then put whatever material I want to record this bite registration. So let me show you first using bite putty. So we're going to take again our very firm bite putty, open up. We can sort of see how much we have to put in. I can come right up to the cuspids here. Let your jaw relax, close slowly, right into that spot, hold it right there. She closes right in, and I can just let that set. All I want is just cuss tips. Make sure that sets nice and hard. Okay, open up. We can pop those off. So what I can do now, once I have this bite registration material, you can take the other one out, Nadine. I can go ahead and trim off any tissue areas with a very sharp scalpel, because all I want to leave are these cuss tips. Notice how this is really deep. Gets around all into the interproximal and into some tissue areas. So I can trim all of that away and just be left with the cuss tips. That will then very accurately mount those models. Okay, so let me do the other side. And so again, what you see is just cuss tips, and trim off anything else that's not necessary. So that would be using bite putty. And then we put those back in and verify them. So I'll go ahead and Slip this back in. Bite down gently. So again, she goes right into that index. Notice the cusp tips that we're seeing. We can see very clearly. That looks really good. Open up. Okay, so now let's record a relationship that we've developed some comfort in wax. So this is the Denar Bite Registration Wax by Whitmix. One thing I want you to notice is it is already cut out for you to fit around this Deprogrammer. And too many times that they don't cut out enough, and this is cut out just right, and I'll show you that on the Deprogrammer. The other thing, it may look narrow, but it's actually not. This has a very good width to it to cover the teeth. So, and I'll show you that as I place it in initially. Notice how it's overextended buccally. So it gives us plenty of room to trim this to fit our patients, whether they're small or large. So let's go ahead and we're going to heat this up and fit this in the mouth. And notice we don't have to heat the whole thing. You could use a water bath if you wanted, which works very well, but I tend to want to keep the middle a little bit firmer, so I heat just down the sides. We're not trying to capture the anterior teeth with this. We're trying to just capture the bicuspids and the molars. And notice how you want to heat it a little slowly. Don't heat it too quick or it'll start dripping. We want that heat to soak in a little bit. We want it nice and soft, but not running. We can see how it changes color slightly when it gets a little bit warm to the level that we want, and that takes a little bit of practice. So now we're going to bring it over here, and one of the first things we're going to do is just fit it to the top teeth. Right distal to the cuspids. Okay, you know how to hold that. Let your jaw relax gently. Close slowly and just keep closing. We're going to close right into that index again. Open up. And notice how quickly we can work. So now I have indentations of the patient's teeth. I can take some large scissors like this, cut right down the buccal cusp tips, remove the distal tissue area from the distal of the second molars. And then the lower I can even angle out slightly to get rid of some of that excess there. And if I have to, I can reheat it a little bit, but a lot of times we don't even have to reheat it if we work quick enough. Very nice. Slip it right back in. Okay. My assistant will hold it. And Nadine does a really good job here holding that and getting out of my way. Close slowly. Squeeze. Hold it right there. Okay. Don't move. Now, very important step is I'm going to adapt this wax. And notice how nice this wax holds the heat. Notice how it holds that heat so I can come in and adapt that right to those buccal cusp tips. Very nice. Once I have that adapted, I'll use some air to chill it. Open. Then I'll snap this out and actually float it in a cup of water. A chilled water, not ice water. Just cool room temperature water, and I'll let that float a few minutes to really chill, and then I'll go back and verify it in the mouth. So you can see how we've got nice just cusp tips again on this. This Deprogrammer allowed her to not bite too deep, so I didn't have to do a lot of trimming on this case. We'll slip that back in. The first thing I'm going to check is it solid on the upper arch? It's solid. I'm not getting any rocking. Nadine's going to hold that again. And I'm going to go close slowly. And I'm going to feel if there's any deflection, if there's anything hitting before she gets into that index that we developed earlier. But now we're finished. You can see how quick and easy it is to take a wax bite in this fashion. Open up. The nice thing about a wax bite that I prefer over the bite putty is the fact that it's cross-arch stabilized. If you have two pieces of putty, they can shift a little bit laterally. This is cross-arch stabilized. Also notice we have just cuss tip contact, and that's an ideal situation for a bite to fit into the models accurately. Now I'll go ahead and float this, and that's how we will store this, floating in water until we're ready to use it. One of the things that I've tried to show today is that the Denar Deprogrammer by Whitmix is one of my favorites, and the reasons for that. But I also mainly wanted you to see how easy it is to use to deprogram a patient who has a occlusal muscle problem, and how easy it is to use the Denar wax to record that centric relation. One thing I feel I should mention, when that wax is used to mount models, one of the key reasons for that wax is that it's brittle. And if that goes on the model and it's forced, it'll break. But that's good because it shows you that there's a problem. Something wasn't fitting right. But once that wax is cooled, it's very brittle. So handle it carefully and be aware of trimming it as you need to so that it fits the model real well and that it doesn't break when you're putting it on the models. But that's one of the keys to using that wax. That's why I like it so much. But again, one of the things I wanted you to see is how quick and easy we can deprogram a patient, capture a bite registration, and use that to mount models that we can then study the case further and decide what needs to be done.